angiotensin-aldosterone system. This begins with a hemorrhage, also better known as when you bleed, or extreme dehydration. The extreme dehydration then leads to a decrease in blood volume in the body. The decrease in blood volume then affects the kidneys because that leads to a decrease in the kidneys, the blood flow in the kidneys, and then that triggers the production of renin inside the jugular apparatus, and then that produces renin, and that is secreted, and through the bloodstream it triggers the angiotensin formation. So within the liver, the renin converts angiotensin to angiotensin 1. And then the angiotensin 1 then targets the lungs, and within the lung capillaries, ACE converts angiotensin 1 to angiotensin 2. Angiotensin 2 then does three things. First, it triggers a vasoconstriction of veins and arteries, and that leads to an increase in total peripheral resistance. And then total peripheral resistance increases your MAP, which is also known as an increase in blood pressure. Then the angiotensin 2 also targets the aldosterone system. It also targets the zona glomerulosa, which secretes aldosterone. And as aldosterone is stimulated, that targets the kidneys, and then within the kidneys collecting ducts, that increases the reabsorption of sodium and also H2O. And then that also leads to an increase in blood volume and an increase in blood pressure, also known as increase in MAP. The angiotensin 1 from the lungs also targets the posterior pituitary, located here, and that stimulates the antidiuretic hormone, which increases in H2O absorption, so it makes you thirsty. And then that also leads to an increased volume of blood and an increased MAP, which is blood pressure. And then again, this is the renin angiotensin aldosterone system. It starts with a loss of blood when you begin to bleed, extreme dehydration, and then it leads to an increase in blood volume and increase in blood pressure, also increase in MAP.